नमस्कार। हेल्थ फॉर ऑल में हम एक बार फिर हाजिर हैं नए एपिसोड के साथ। कोविड-19 वायरस का डर अभी पूरी तरह खत्म नहीं हुआ है। हर बार ये एक नए वेरिएंट के रूप में हमारे सामने खड़ा हो जाता है। इस समय पूरा देश ओमिक्रॉन वेरिएंट की चपेट में है। कल हो सकता है कोई नया वेरिएंट आ जाए। तो हमने सोचा कि अब अगर वेरिएंट के साथ ही हमें कोरोना के साथ ही जीना है तो क्यों ना कोविड मैनेजमेंट के तरीके से जान समझ लें। इसलिए हमने आज के एपिसोड का टॉपिक कोमॉर्बिडिटीज एंड कोविड मैनेजमेंट रखा है, जिसमें हमें अलग अलग फील्ड के डॉक्टर्स ये बताएंगे कि अगर आपको पहले से कोई गंभीर बीमारी है तो कोरोना होने पर क्या करना चाहिए और क्या नहीं।
We have with us Dr. Pooja Pandey, a certified yoga expert, an expert in aerobics and Zumba, and runs Arogya Physiotherapy. She has been combining all these techniques for better living. She is the creative spirit behind her successful YouTube channel called Arogya Physiotips.
So today the topic for yoga is obesity for yoga. Okay, so very important thing to understand here is when we talk about obesity, we also have to talk about being lean. Okay, so I don't think so being lean or obesity is a disease. Not being fit in your body frame is a problem. You agree with me? Because at the end of the day, even if I am thin and I feel fatigue and I feel weak, okay, and I am only surviving on salad and not eating anything to give me energy is also a problem. When you want to lose weight, you start with Kriya. Okay, you start first, you clear your body for it to start losing weight. Every day eating rubbish creates so much toxins in our body. So first is clear the toxins. Okay, the second is yogasanas. In losing weight are the yogasanas, which are basically forward bending, because you are using your abdominal muscles to forward bend. Okay, so it decreases the fat around the abdominal area. So if I do something called Paschimottanasana or if I do Naukasana, then it is definitely helpful. Now when I say Naukasana, you need to perform, basically you need to go down and then come up and hold, toes pointing towards yourself, and hold this pose for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You don't hold your breath in any of the yogasana. Okay, very important is you don't hold your breath. Now another forward bending pose which we can do is Paschimottanasana, where I go down. You need to go down not from your back, from your hip. So you go down from your hip, try to go down as much as possible and hold this pose. Try to bend your elbow as much as possible. Hold this pose. Okay, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, and relax. So all the forward bending pose will help you lose weight.
Today we have with us Dr. Amitabh Banerjee, who is professor and head community medicine at Dr. D.Y. Patil Medical College, Pune. In his previous roles, he served as medical officer, epidemiologist at Indian Armed Forces, and an associate professor, community medicine at Armed Forces Medical College, Pune. Speaking to him is Dr. Swadeep Srivastav, one among India's top health communication experts and founder of Heal Foundation and Heal Health, which have been at the forefront of health awareness through healthcare communications. Heal Foundation and Heal Health have been instrumental in creating campaigns and platforms for healthcare improvements in India for the last 2 decades.
Whereas if you look at the Indian palette, and particularly, so don't you, because this has been one of the key points of discussions in the recent times, some studies also come, I think government also has been highlighting the overuse of carb-rich food, carb-rich food in our diet. So you definitely, the sugar is the main culprit. Everybody knows, sir. But even carbohydrate in what we eat in our Indian diet is like, if you see the plate and the picture of Indian diet, forget about the American burger and all those diet chips and all. But even in Indian diet, sir, don't you think that the portion of rice, roti is much higher than vegetable and dal if you look at the overall plate? Whereas in Japanese or even in foreign countries, whenever we go in Europe or US, or we travel and we eat at the restaurants, so we see that there's always a lot of emphasis in terms of the filling the plate with more vegetables and maybe beef or the chickens and everything, and less of bread or everything. Everywhere you start with some salad or some more rich veg. So is there any data available on this, that Indian diet Indians eat more carbohydrate compared to other countries? That's why that can be one of the reasons of imbalance in nutrition, sir.
You're perfectly right, Dr. Sudeep. Indian diets are high in cereals, and it's like rice and wheat, which are almost 60-70% they get the calories from carbohydrate. So there is, of course, these carbohydrates are not very desirable, as you said, if you are having excess of carbohydrates, but they are less harmful than very rapid carbohydrates like sugar, maida. So if you take, multi-grain they take now, we combine it with bajra or wheat. They are also carbohydrates, but they do not have that sudden rise in blood sugar. Glycemic index is less, firstly. Secondly, as you said, the too much of rice, it is a matter of economics also. Poor people cannot afford too much of vegetables. Fruits are getting very costlier. So they cannot afford. So for them, the staple diet will be a bowl of rice or a big thali of rice. I have seen poor people eat it with some salt and water also, nothing else, because that they have to fill their year. But fortunately, what happens, the poor people, they are working more also. They are doing more physical activity. 6-7 घंटे वो काम करता है, तो उसका क्या होता है कि उसका कैलोरी इंटेक मैच हो जाता है. And awareness among the rich people, they can afford to have a variety of diets and cut down on carbohydrates. They can have fruits. They can have, actually 5 helpings of fruits are recommended. Minimum 5 helpings, 35 gram in each helping. Almost this 5 helpings of fruits and lot of vegetables. So that gives a diversity. They say as much diversity in the diet, and cutting down on the carbohydrate. Firstly, refined carbohydrates, and secondly, as you said, the other too much of rice, which can form the bulk of the year, can be unbalanced a little. But poor people cannot afford it. So we can have some consolation that they work it out. They do the physical activity, so the balance remains, and they can, if they are working in the fields, they may take some gajar or mooli or something. They take vegetables also. They may be munching, but that awareness can be increased. And the poor people can be told to grow their own vegetables, like the kitchen garden, other things. So that way, it may be a matter of economics.
Yeah.
The Union Health Ministry has advised the COVID-19 patients to undergo tests for tuberculosis and other conditions if cough persists for more than 2 to 3 weeks. The ICMR has also listed active TB as a COVID-19 comorbid condition. Your comments?
Yeah, so there are two things. Initially, also, when there was a cough persisting more than 2 weeks, we used to get our sputum examination done, the cough to be checked for tuberculosis. But during this COVID era, it has become very important for all of us to focus on this. If you have cough with COVID, maybe now or in past recent COVID, maybe around a month or so, you need to have checked or diagnosed the reason of your cough, because in COVID, we do give steroids sometimes for management of COVID, which may flare up the disease if you have underlying tuberculosis. So you need to cross-check and be rest assured that there is no underlying tuberculosis within your system.
Drowsiness in evenings is common among patients who have recovered from Omicron variant. It affects people in the 35 to 54 age group. While some doctors say that feeling of drowsiness in the evenings is a new sleep cycle related symptom, others say that energy levels peak during the afternoons and generally decline towards the evening. This process is probably accelerated for a person who has just recovered from COVID-19.
See, earlier COVID, we have learned that there's a post-COVID syndrome, the long-COVID syndrome. And this syndrome comprises of various features like weakness, not able to sleep properly, not able to eat, loss of appetite, hair loss. All these symptoms were very common after the post-COVID recovery. Now, with the variants, it is very difficult to pinpoint that Omicron is causing weakness in the evening only. So I believe this is a overestimation of the variants, symptoms. But I believe it's part of the post-COVID recovery syndrome, which happens with any viral illness or any other stressful illness and during the recovery period. And these syndromes, basically it's all about nourishment and nutrition. I have seen in my experience a lot of these patients, once you are giving them supplements properly like vitamin D3, calcium, and B complex, B12, omega-3 fatty acids, these patients respond wonderfully to these supplements. And these symptoms gradually wane. And sleep cycle definitely gets disturbed during the COVID because you are ill, you are not able to sleep properly, there are various symptoms. But you have to emphasize on the patients that they have to maintain their sleep cycle, and that's how you can get away by these symptoms.
अगर किसी को हाई ब्लड प्रेशर की शिकायत है और वो दवा लेते हैं और दवा से उसको कंट्रोल में रखते हैं और उन्हें कोविड इन्फेक्शन होता है, तो ये कितना खतरनाक है कि कई लोगों में ये देखा गया है कि वो बिल्कुल नॉर्मल है, बीपी की कोई शिकायत नहीं है, लेकिन कोविड इन्फेक्शन के बाद जब वो ठीक होते हैं, नेगेटिव होते हैं, उसके बाद उनको हाई बीपी होने लगता है। तो ये समस्या क्या टेम्पररी है या फिर उनको दवा पे, मेडिकेशन पे जाना पड़ेगा?
देखिए सर, इसमें क्या है कि जिस पेशेंट को पहले से बीपी है और बीपी की मेडिसिन रेगुलर ले रहा है और वो कंट्रोल चल रहा है, उसको सडनली पता चलता है कि कोविड है, फीवर है। उस फीवर में अर्ली स्टेज जो रहती है, जिस टाइम पे फेब्राइल इलनेस स्टार्ट है, उस टाइम पे ब्लड प्रेशर में फ्लक्चुएट टू द लोअर साइड। तो जो पब्लिक को मेरा मैसेज ये रहेगा कि जो पेशेंट ऑलरेडी बीपी की दवाइयां ले रहा है, उसको कोविड इन्फेक्शन हुआ अर्ली स्टेज में, तो बीपी मॉनिटरिंग इज द फर्स्ट पॉइंट। if required, the BP medicine dose should be reduced in the early phase, and after that, when the recovery starts, then again the blood pressure may shoot over the level which is he prevented by the same medicine. Just then that time may require the increased dose of the medicine. So during this COVID illness, the patient should monitor the blood pressure from the starting of the illness to the recovery, and may after for 3 months also. Because after this viral illness, then hypercoagulable stage will go on proceed in the body that may increase the blood pressure by the sympathetic overdrive also. So blood pressure management requires the BP monitoring from starting of the illness till the recovery, and post-recovery 3 to 6 months.
Now, a new study by AIIMS in New Delhi says that unlike during the earlier surge of pandemic, surgeries are safe and not associated with higher chances of complications or deaths in those with Omicron variant. The Union government has also endorsed this view and said patients should not be denied surgery.
Yes, this is absolutely true. This is mostly because of the change in the virulence of the Omicron variant this time. So the earlier COVID variant were much more seriously causing the disease, and we really didn't know how this COVID is going to evolve, what is going to be the various manifestations. And in fact, in the first wave, just before the first wave, it was very difficult to even know what is going to be the treatment strategy for such patients. Slowly, of course, we evolved into this is how the patients need to be managed, but still the severity of the disease was not known, and that is why during the second wave, it was only during the around first and second, only the emergency surgeries were performed. The elective procedures were all delayed. Why this was done was, first of all, it would result in again transmission of infection to patients who do not have COVID-19, and in case they develop COVID-19, then again the complications are going to be more. This was also because if suppose the patient develops COVID-19, then he goes into the COVID-19 ward, ICU, where the kind of care is going to be a little more different. So in the earlier waves or with the earlier variants, yes, only emergency surgeries, but now with the Omicron variant, definitely we can perform the routine procedures as well, because the risk of transmission, although is high, but it is definitely resulting in a mild disease, and most of the patients are not needing steroids until and unless there is a comorbidity.
अगर किसी को टाइप 2 डायबिटीज है और वो नियंत्रण में है, वो एक्सरसाइज करते हैं और सारे प्रिकॉशंस लेते हैं, नियंत्रण में है, और उनको कोविड इन्फेक्शन होता है, तो वो कितना फेटल होता है?
टाइप 2 डायबिटीज अगर नियंत्रण में है तो जनरली वो कंडीशन जिस कंडीशंस की वजह से टाइप 2 डायबिटीज नियंत्रण के बाहर जाती है, जैसे कि मोटापा, स्ट्रेस, अनबैलेंस लाइफस्टाइल, तो नियंत्रण में अगर टाइप 2 डायबिटीज है तो इसका ये मतलब है कि उस आदमी का स्ट्रेस लेवल मोस्टली कंट्रोल में है, वो आदमी मोटापे से थोड़ा सा दूर है, उसका बाकी न्यूट्रिशन वगैरह ठीक चल रहा है। तो इन कंडीशंस के अंदर अगर HbA1c जो हम मॉनिटर करते हैं, जो कि डायबिटीज़ के बारे में बताता है कि वो वेल कंट्रोल्ड है कि नहीं है, 6.5 के ऊपर जैसे HbA1c होता है तो उसको डायबिटीज़ होता है, अगर 8 के नीचे HbA1c है तो कंट्रोल बहुत अच्छा चल रहा है, और अगर टाइप 2 डायबिटीज़ का कंट्रोल अच्छा चल रहा है तो ज़रूरी नहीं है कि कोविड के सिवियरिटी वगैरह उन मरीजों में देखी जाए।